The holidays are here, and deep frying a turkey that's not totally thawed or putting up Christmas lights while on a ladder that's not steady can have you spending the most wonderful time of the year in the emergency room. And these days, that doesn't have to mean going to a full-fledged hospital. 12 News' Leah Durain joins us in studio with a special report on what you need to know before you go to the nearest medical care facility. Leah.
Well, while Southeast Texas offers medical treatment in all shapes and sizes, and with care centers popping up in strip centers and on street corners, knowing where to go when disaster strikes is crucial to the patient's care and your wallet. In the late hours of a September night, Tiffany Saunders knew the pain in her chest was a bad sign.
I've taken breathing treatments before, just, whenever I was sick, and this was just so different.
She decided to head to the Beaumont Emergency Center to get the intensifying ache checked out. She was hoping for quicker treatment due to a previous experience at a major hospital where she had to wait for 3 hours in the ER following a car accident. Beaumont Emergency Center is open 24/7 and sees a lot of patients who need quick help but don't want to wait. How long you wait for care is high priority among patients like Saunders. So we looked into just how long it takes before a patient is seen. Beaumont Emergency Center boasts a wait time of 0 to 5 minutes. The Christus Hospital Network claims an average wait time at St. Elizabeth is 30 to 45 minutes.
We worked on decreasing our wait time to see a provider. For a very large emergency department such as ours, that's a pretty good time.
Wait time is even less at the Christus Minor Care Centers in Port Arthur and Beaumont. With a fast-track program in place, patients are seen by a physician or a nurse practitioner within 15 minutes. But don't let the minor care name fool you. The centers are still in the Christus Network, and the Southeast Texas Executive Director, Jane Rawls, says these places charge an emergency room fee. Those fees can add up if you don't do your homework before your arrival. Most importantly, check first to see if the facility is in your provider network. If it isn't, plan on paying a lot. But if it is in network, fees vary. For a Blue Cross Blue Shield PPO, the copay to visit your primary family care doctor is $30. When visiting urgent care clinics, the copay is $75, and both freestanding and hospital ERs charge a $250 copay. Each facility can treat a different range of illnesses and conditions. Showing up to one center that doesn't have the tools to treat you can cost you both time and money. AFC Doctors Express is an urgent care clinic with extended and weekend hours. The urgent care clinic says the nurse practitioners, physician assistants, or the MD can run all sorts of tests, check your baby's cough, conduct x-rays, or splint a broken bone. The Beaumont Emergency Center says their facility can take care of those same medical needs, plus the emergency room certified doctors and nurses can also handle greater cases like chest pain.
I always say a broken ankle to a heart attack and everything in between we're ready for.
Staff members are ready to stabilize any condition, but patients needing emergency surgery or other specialized medical procedures have to be transferred to a hospital, and the ER can decide not to accept ambulance drop-offs. Christus Hospital St. Elizabeth has their own emergency room, but also accepts transfer patients from the freestanding centers when patients need surgery, have head trauma, or need a cardiac specialist.
If you actually go to a freestanding emergency department and have a complaint such as chest pain or maybe appendicitis, that could actually delay your care. So coming to a hospital like ours, where we can see you rapidly and take care of you faster, would be better for your outcome.
But someone like Saunders, who found out the lining of her lungs were inflamed and did not need to be transferred to a hospital, the freestanding emergency room was the right choice.
Everybody was so nice, and it was so clean, and all of that. I was really happy with the decision.
Now, the Beaumont Emergency Center accepts all major insurance except Medicaid, Medicare, and TRICARE. Christus and AFC Doctors Express both accept all major insurance, but it's important to know which facilities are in network. I encourage viewers to log on to their insurance company's website, where you can search in-network locations and even price out some common incidents. I have let's see, Cigna pulled up here, different plans. You just log in with your information, create an account. This is the prices at various Baptist Beaumont Hospital Medical Center, Southeast Texas. And this is for ear tube insertion. So it costs out the total estimated cost, your estimated cost. This is per, the factors are your deductible, co-insurance, things like that. So I encourage you to poke around. You can search different locations and procedures, so really check that out. Do that now, because when an emergency does happen, you're not going to have time to look up all this coverage details. So have a plan in place. It can really save you some time and money. Plus, you'll be confident in your choice, which will, can show some strength for someone who is involved in that emergency situation. Reporting live in studio, Leah Durain, 12 News HD.